to allow someone to see again is both a gift and a privilege. And it's the true calling of medicine. You just bring what you can provide, and you find somebody who needs your service. It comes after years of hard work. To master the technique of doing the surgery. It's like an individual who plays an instrument. After a while, they can hear the music, and they're not even aware of what their hands are doing. They're playing mostly with their ear. I am Dr. Robert Weisenthal. I'm a clinical professor of ophthalmology at Upstate Medical University and a member of CNY Eye Care in Syracuse, New York. I started doing cataract surgery in 1988, and over the years, I've operated on thousands and thousands of patients. But starting in 1991, I came to Honduras, and it really shows to me personally the reason I went into medicine. It's truly about being able to help an individual regardless of what their circumstances are. And so I think for many surgeons and the ones on this team who come here, it's that opportunity to use our skill sets to help people who truly need it. Our patients are brought to us in collaboration with the Ponce family, who run the Ponce Eye Clinic in La Ceiba, where we do our operations. We have worked with the Ponces for over 30 years. So I feel privileged to be part of this group. And for the patient, I imagine, it must be some sort of miracle to them at the end to be able to see again. And you can see that in the faces of the patients when we take off the patch and they, for the first time in many years, can look around them and see things they haven't been able to see in the past. It must be so strange for them. For instance, can you imagine that you come from an area that is remote in Honduras? You've rarely traveled out of the city. You are brought to a strange location. You are seeing people who are speaking in a language you do not understand, with words that make no sense to you. They bring you into a room and you're instructed by someone that you trust to lay down. Drapes are put over you. And then they start the operation, and you're aware of sensations like their voice, the music. During the surgery, you may see a light show because as the instruments pass under the microscope, they create these brilliant colors. And then after a time of laying still and perhaps praying that whatever is happening is not ultimately going to lead to a bad outcome, they put a patch on your eye and they send you out. And then the next day you go back and they take off the patch and then you can see. It's difficult to communicate verbally with these patients, but you can have a sense of how to relate to them by your movements, your actions, and your caring. We've done this mission for 30 years. We do this with the help of an organization called the Surgical Eye Expeditions, which works with the Elcon Foundation to provide us with supplies. We are indebted to this organization, and we are indebted to the surgeons who come along with us to spend long, arduous days in the operating room with highs and lows. And we have the privilege of working as a group towards a single goal of helping people who need it. And I want to recognize the surgeons who were on this trip, Dr. Tom Bersani, who originally got me involved in coming to Honduras, Dr. Evis Petrella, and Dr. John Haymore, who were the anterior segment cataract surgeons who came with me, and Dr. Rob Hill, who's an oculoplastic specialist. Together, we did probably 150 surgeries in 5 days. And it was a very successful mission trip. And it is something that will carry us forward to the next year.